And so we have a port creator that comes with the sharp needle. Let's zoom in on this because I want to show this. Oh yeah, look at Shelby's side. Looks very nice. Both sides look awesome and tight and firm, and she did a great job. Now let's zoom in on this. If you were going to decide which of these devices you would do an arterial blood gas with, can you zoom in even closer? What would be a nice or the best, most efficient way to get into a small 1.5, 2 millimeter artery? You're probably going to have more opportunity with a spear than a blunt object. So this, in my opinion, is more likely to get in a small facial vessel like transverse facial labial artery than a blunt cannula. However, no one will ever prove that, so I like cannula because it's fast, less bruising, less pain, and I can do a retrograde linear technique. As I advance with a sharp needle, I'll get more bruising, piercing small vessels. But I use this sharp needle zoom out now to get under where I want to go. So I want to get the tail of the brow up. And she's got a high central brow. So I'll drop her central frontalis. I'll let the lateral frontalis lift to some extent, and I'll lift her lateral supraorbital buttress. She has a nice temporal hollow, doesn't need that. So center this in the screen here if you can. Beautiful. And so I pop under, watch out for veins, spread. That's my port creator. I park this. I take my HA gel, which is, let's say, Prolinium or Restylane or Juvederm. I pop under orbicularis oculi. I'm supraperiosteal, remember I'm deep. I take my 1 ml of whatever you like to use with lidocaine, and I'm going to use about 0.5 cc's, retrograde, linear, toothpicking, advance and jet, 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 advance and jet. On the way back, slowly, advance and jet, on the way back. And create a little vertical elevation. Now, I'm above the hair. I want it to lift. If I'm under the eyebrow hair, it may pull it down. I stay above the hair, and it gives an immediate three-dimensional lift of the tail of the brow. If she was hollow in her temporal area, I can simply turn and go under the temporoparietal fascia and inject in the temporal hollow. She doesn't need that. So that's supraorbital volumization. If you look, right away, you get a little tail of the brow elevation, just by a little bit of filler right here, lifting that three-dimensionally. Then I'll drop her central dolorous brow so the tail kicks up. That's the best I can do for her brow non-surgically, other than a suture suspension lift of her brow, which we're not doing today. Now for the infraorbital buttress, remember that's medial to lateral canthus. I come down the nasojugular groove, down the orbital malar groove, tilt down a bit, now Kim if you can, just under the malar eminence, and I pop through right here. That allows me to do the nasojugular, orbital malar, and up the zygomatic malar buttress through one port. Spread, park the needle, and I simply go up under the orbicularis oculi. You want to minimize Tyndall effect. So down to the malar eminence, right on the bone, slide right up. Now I'm up into the medial canthus, but I'm under orbicularis oculi. I can use Restylane, Prolinium, Redensity, which is more viscous, so I don't get a lot of hydrophilia here. I don't want to get hydrophilia of the lower lid orbital fat pad. I want to stay suborbicularis to minimize that bluish discoloration or Tyndall effect. Little retrograde toothpicks down the nasojugular groove. I want to go back and forth to hide, remember that orbital rim? I want to help hide it by lifting and by small amount of volume. So 1 cc under the eye. I'm going back and forth across the orbital rim with toothpicking. Advance and jet on the way back, advance and jet on the way back. Right to the lateral canthus, then I go back again. Now you're wondering, what does he mean by a toothpick? So let me show you. And I'm using my finger to protect the orbital rim. As I advance, I inject retrograde, a little toothpick like that. Zoom in on that if you can, Kim, a bit. See that little toothpick? Then I go beside it, I advance, inject on the way back. Advance, inject on the way back. I lay down little toothpicks horizontally under the lower lid or vertically on an area. And as I advance, I create a tunnel. When I retrograde, it closes off and holds it so it doesn't drift.